Abdominal pain is one of the most common health problems we all face. We've all been there: sudden ache, a cramp, or a sharp twinge in our belly. But while it's often just a minor annoyance, sometimes that pain is a signal of something much more serious. Knowing the difference can be life-saving. So, what exactly is abdominal pain? Medically speaking, it's any discomfort you feel in the area between your chest and your pelvis. This pain can show up in many ways. It might be a mild, lingering ache or a severe, sudden jolt. It could be acute, meaning it comes on quickly and resolves, or chronic, lasting for weeks, months, or even longer. The nature of the pain itself is a crucial clue. Let's break down the different types of pain you might experience. Is it a sharp, stabbing sensation? This could point to something like a kidney stone or a gallbladder issue. Or is it a dull, persistent ache that might suggest inflammation or an ulcer? Then there's cramping, which often comes in waves and is typically related to muscle contractions in your digestive tract, common with gas, diarrhea, or constipation. A burning sensation, especially in the upper abdomen, is often linked to acid reflux or gastritis. Finally, colicky pain is a severe, fluctuating pain that comes and goes, often associated with blockages in the intestines or gallstones. Each of these feelings tells a different story about what might be happening inside your body. The list of potential causes for abdominal pain is long and varied. Many are relatively harmless. Simple things like trapped gas or indigestion after a heavy meal are very common. Food poisoning can cause intense cramping and discomfort as your body tries to expel harmful bacteria. Inflammation, like gastritis, inflammation of the stomach lining, can cause a persistent burning pain. And, of course, constipation is a frequent culprit behind lower abdominal pressure and cramping. However, some causes are far more serious and require immediate medical attention. Appendicitis, the inflammation of the appendix, typically starts as a dull pain around the navel that moves to the lower right abdomen and becomes severe. Gallstones can block bile ducts, causing intense pain in the upper right abdomen, especially after eating fatty foods. Kidney stones create a sharp, excruciating pain in your back and side that can radiate to your lower abdomen. Chronic conditions like irritable bowel syndrome or IBS can cause a mix of cramping, bloating, and changes in bowel habits. Peptic ulcers, which are sores on the lining of your stomach or small intestine, often cause a burning stomach pain. Where you feel the pain can also provide vital clues. Let's divide the abdomen into 4 quadrants. Pain in the upper right quadrant often points to problems with the liver or gallbladder. If the pain is in your upper left quadrant, it could be related to your stomach or spleen. Pain in the lower right quadrant is a classic sign of appendicitis. And pain in the lower left quadrant can indicate issues with the colon, such as diverticulitis. While these are just general guidelines, they help doctors narrow down the possibilities and order the right tests. It's critical to recognize the red flag symptoms that signal a potential emergency. If you experience abdominal pain that is sudden, severe, and unrelenting, seek medical help immediately. Other warning signs include a high fever accompanying the pain, vomiting blood or a substance that looks like coffee grounds, or passing black tarry stools, which can indicate internal bleeding. If you feel faint, dizzy, or your abdomen becomes rigid and hard to the touch, this is a medical emergency. These symptoms should never be ignored. So, what should you do if you have abdominal pain? For mild pain that you suspect is from indigestion or gas, rest and hydration can help. You might try sipping clear fluids. However, avoid self-medicating with strong painkillers, as they can sometimes mask a more serious problem or even worsen it. If the pain is severe, persistent, or accompanied by any of the red flag symptoms we discussed, your next step is clear. See a doctor or go to the emergency room. An accurate and early diagnosis is the key to effective treatment and can truly save lives. Your body sends you signals for a reason. Listening to it is one of the most important things you can do for your health. Stay aware and stay safe.